Hello, and welcome to Psyched for Sanity. I am one of your co-hosts, Dr. Brendel Doss. I am a clinical psychologist specializing in trauma treatment, forensic psychology, geriatric psychology, and assessment.
And I'm Dr. Tara McKelvey Parker. I am also a licensed clinical psychologist working in private practice. I specialize in assessing and treating complex trauma and attachment wounds from childhood. And I want to tell you this little story that inspired today's episode.
Oh, goodness. Yay. And oh goodness.
The star of the story is my child, who is 4.
Naturally.
Okay. And historically speaking, there have been many meltdowns involving her wanting to do something.
Right.
That I accidentally do first because it's just sort of like normal human behavior.
Right.
So like going to open a door, for instance. My child may be really angry about that because she really likes opening doors.
She does. I've noticed that.
She's really into it. She's really into doors. She spent like a year at Little Gym opening doors for people. That's like how she was exercising those core muscles. I'm telling you. And so I just let her do it because I'm like, cool. Like it's core
as long
exercise,
as she's safe, you know?
right?
Yeah.
It's a skill she's building, whatever. But anyway, she would have pretty epic meltdowns about things like that.
Okay.
You know, if I like deemed it appropriate maybe to like break her banana in half and she really wanted that banana whole, it might like result in an epic meltdown.
Yeah.
Right. And that's pretty common for toddlers. But, you know, my daughter, she's 4, like closer to 4.5, and we haven't really had those meltdowns in a while. There are meltdowns about other things, but that has like kind of, you know, been a thing of the past.
Sure.
The other day, I was making her dinner.
Yes.
And she asked for a piece of cheese with her dinner. And I was like, sure. And I went to get it. And I was going to like unwrap the cheese. And she had one of those meltdowns. And it lasted probably at least 5 minutes. Rolling around on the floor. Full out meltdown because I had opened her piece of cheese.
How dare you?
And she really wanted to open that cheese.
My gosh.
And then so I was like, oh my gosh, like is something going on? Why are we having this meltdown again? It's been a while.
Yeah.
And so then I thought, you know what? It is so often that I'm worried about something with my daughter because I don't really know what's developmentally appropriate.
Or maybe you don't remember in the moment.
Or don't remember in the moment, sure. Or like, you know, so I thought it might be really helpful to have an episode on, or episodes on child development. Because I think the more that we know as parents, the more we know, like, okay, what's typical, what's normal, when to seek support. It can just help us with our, I think, like low-level anxiety that we always feel.
Distress tolerance.
about our children.
Right. Well, fun tidbit, I once had a patient who had a 3-year-old, and that 3-year-old melted down because the father would not let the patient eat a dead fish that was on the side of a lake. Not sushi, not a cooked fish, but a dead fish that was on the side of a lake.
Yeah.
So I hear you about the wrapping of the cheese. I think that's common that we hear, and those are just, it's like so frustrating because it's like, why are you so irrational?
Well, and I kind of felt like a part of me was like, I thought we were like moved past this. I thought we were over this. So that's why I really wanted to do, because of course I was like, you know, on ChatGPT and like Googling like, you know, what's going on. And so then I was like, you know, like, okay, this is like apparently kind of normal. So these regressions and these ebbs and flows. So why don't we do an episode on child development? And since we both have kids in the 3 to 5 range, we thought we'd start there.
We know a lot about
the most baffling
development of that time.
Yes. And one of the more like baffling sort of age groups.
Baffling, exhausting, overwhelming.
Exactly.
Yeah,
so
absolutely.
Ages 3 to 5, we wanted to go through what's developmentally normal so that we can kind of help you guys feel a little bit more confident, a little less anxious if you're like me and you're like, I thought we moved out. I thought we moved past this. Is this normal? And do I need to worry?
Right. That's always the question I think a lot of parents have is, do I need to worry?
Yeah.
Is this something I should like seek support with?
Yeah. So ages 3 to 5, big feelings.
Yep. Big imagination.
Big boundary testing.
Right.
Really rapid skill development. Like overnight, right? Like your child could be acquiring a new skill.
Like they wake up one morning and they're like acting like they're 17.
Right, exactly.
Yeah.
But also, and this helped me when I was thinking about my daughter, and you know what kind of inspired this episode was like the idea that development is uneven.
Yep.
So like in some categories, your child could be pretty, sort of advanced. In others, they could be right on track. Within each domain of functioning, there's a lot of regression and inconsistency.
Yes. Sometimes we have to take steps backward to take steps forward in development.
Right. It's sort of like up and down,
sure.
back and forth.
It's not a progressive stair-step, stepwise fashion at all.
Exactly.
But we want it to be that.
Why? Well, and we kind of think it should. I don't know if we naturally think about like growth means up and down or it means regression.
Right.
That's just really normal. So that helped me when I was thinking about my daughter in terms of this meltdown, because it's like, well, she's like had it pretty, we haven't had that challenge in a while, but it makes sense that there'd be a little bit of a regression, or like, in some instances, she may be more upset when she hadn't been for like weeks. So it's like, if you ever find yourself thinking my child should know better at this age, it's probably a little bit of a trap, because they just kind of they're in and out of skill development.
Right. Well, they have a lot of, they can perform them, but it's really inconsistent.
It's really inconsistent. Right. So that's the point I'm trying to make is like with, my daughter's meltdown, it's like makes sense that she would revert back, or she'd have some trouble when she had been able to do it before, because it's so it's inconsistent development, uneven.
Yeah.
So, I mean, we thought we could maybe go through some different domains of functioning and kind of talk through what is typical for this age group, 3 to 5, and when you may want to seek some support.
Yeah, and when we say domains of functioning, we really mean basically areas of your child's life. Because a domain is like, we have, so what would be the first domain as an example?
Like emotion regulation. So this is the one that I'm often thinking about with my daughter, and that came to mind with the meltdown.
Right.
Because, this is one area of functioning that I think can be pretty challenging.
It's very exhausting.
At this age group, because their emotional brain is dominant. Like there's no logic.
No, logic doesn't work.
It doesn't, it's not developed
You cannot
yet.
rationalize with them.
They cannot rationalize. They cannot perspective take. So really it is their emotions that is guiding their behavior.
Right.
So lots of emotion, but very little ability to regulate that emotion.
Right. There's a really famous study that's popping into my brain, and I don't recall the author, so I will have to apologies to the internet and social media world for this. But there's a really famous child development study where they took children and they had like a little miniature scene on a mountain. Do you remember this? There was a miniature scene on a mountain. On one side of the mountain there was no scenery, but on one side there was like little grass and a little train set and like a miniature you'd see. And they put the child, was behind glass, and the miniature was, and they said, okay. And they said, there's another child on the other side of the mountain. What is the other child seeing? And children in this age range said, well, they're seeing the same thing I am.
Right.
So that's the inability
to take
perspective.
To take perspective, right.
I think that comes in around starts to happen around 7 or 8, and even then it's still in flux.
Right, exactly. And then with logic, we really don't see that sort of developing strongly until like 12-ish. So we're just all emotion with really little ability to regulate.
Emotion and water.
So these kids, it is very common to have meltdowns and tantrums.
Yes.
Over very seemingly small things.
Absolutely.
Like me opening a piece of cheese or opening a door.
Right.
For kids this age, they want to do everything themselves.
Yes.
And so it is very disappointing when you open a piece of cheese that they had really decided they'd like to open and you had no idea.
And they're literally developing the skills, hopefully with your help. We have a whole episode you guys can check out on emotion regulation and parenting, on emotion regulation. But that upset and that disappointment is so big, and they have literally no functional or structural understanding of that experience, and so it's just so overwhelming.
Yeah, and that's why at this age kids still largely rely on co-regulation to feel better. They do not have the emotion regulation skills to deal with that really intense feeling that they're experiencing in their body. So we do have a whole episode on co-regulation, but the most important thing is that you are staying calm and you're able to stay present and help contain, When Penelope was rolling around on the floor, I just, sort of stayed nearby, and I was like, yeah, you really wanted to open that cheese. That's really sad, honey. I'm sorry.
Right.
And she, of course, demanded another piece of cheese, and that is where I held my boundary. I was like, we're not opening another piece of cheese, honey. I'm really sorry.
Right.
You're going to have to eat this cheese if you want the cheese. And she ate the cheese.
Eventually, yeah.
Eventually ate the cheese after she was done on the floor. But, the tantrums, the meltdowns over small things, common, co-regulation necessary, the inconsistent empathy.
Yes, I have that experience with my oldest, and it's really distressing. Sometimes I'm like, oh my God. Is there sociopathic or is there psychopathic tendencies that I should know? That's me being dramatic and fear-based. No. But it's really hard to understand that development of empathy and like how you can care for others and care about their experience, because this period of development is so self-focused for them.
Mm-hmm. Yeah, definitely. Another one that's still pretty common at this age is aggression. When overwhelmed.
When overwhelmed, yes.
When overwhelmed.
When
so
really pushed.
Still the biting, the scratching, the hitting, the shoving.
Right.
When overwhelmed.
And it's not from a place of malicious intent or like intent to like functionally cause harm in their way. There's just so much emotional energy, and energy, cannot be created or destroyed. It has to go somewhere, and sometimes it comes out in negative ways from their body, which is really hard for me. We've talked about this as well. We all get really triggered when we're hurt by our kids physically.
Yes.
And it's hard to manage our emotions in that situation.
Yes, and we don't want, I don't want because my daughter does, when she feels overwhelmed, she can still become aggressive.
Right.
Even though that's getting a lot better. And so I don't want, her to hurt other children.
No,
that comes into play too. I start, feeling kind of anxious about, maybe she's going to be a bully, or maybe she'll never grow out of this, or maybe she'll be hurtful to other kids.
Sure.
And, so this piece was also helpful for me to remember and remind myself about. That
my 3-year-old has this, has physical aggression, because sometimes his mouth and his brain cannot work fast enough to come alert us. But when his sister, his older sister's really working hard to annoy him, and she's not listening to him, he will get physical with her.
Yeah.
Because he is so overwhelmed and does not have the resources yet to fully integrate to say, Mom, so-and-so is bothering me, or Mom, get her out of my face.
Exactly. And for my daughter, she has, an expressive language delay and some articulation issues. So speech is hard for her.
Right.
So when she's, especially in the playground or at circle time, and there's a lot of kids around, and turn taking and sharing and all of that stuff is like a component, and it's hard for her to sort of verbally so
what else in this domain do we need to be aware of, and when should we seek support?
As a lot is like sort of pretty still typical,
chaotic
right?
and twirly.
Yeah, but if you're feeling like any of this stuff is really persistent or pervasive, like if we're seeing very severe aggression that is happening more often than not across settings. Or
tantrums lasting longer than how long, like as an estimate. And this is variable, of course.
This is variable. I mean, I would say typical is probably under 30. We're getting closer to that
hour mark, between 30 minutes to an hour.
Yeah, and
that's
it's
different.
like happening more often in multiple settings too. Then you want to ask yourself, is it persistent? Is it pervasive?
Right.
Is it causing impairment?
Is it limiting their ability to be with others, or to learn, or to
function
engage
at school, or to engage socially, or is their mood stuff? Are you noticing, anything like that? You want to ask yourself in all of these domains. That is when you're probably going to want to seek support.
Okay.
So what about attention and executive function? 'Cause that's another one I think wildly misunderstood category. And this is where like concerns about ADHD come in for younger kiddos.
Yes. They don't really have this. They don't have the ability to focus for long periods of time. They cannot, they have still the ability to first like preferred tasks. If they like it, they can sit and do it for 30 minutes. But for non-preferred tasks, it's developmentally appropriate that they have a minute, maybe even 30 seconds sometimes. For certain things.
Yeah, I would say like no more than 5. I've heard like a minute per year of age. So like for my daughter who's 4.5, 5 minutes is going to, kind of for things that she doesn't want to do.
Right.
Like dinner.
Right. Same. My daughter's the same.
This is another area where I've Googled pretty heavily. Like, is it normal that my child doesn't want to sit to eat?
Right.
And it is apparently still
wandering,
very common.
Trying to
grazing, wandering, not sitting for longer than 5 minutes for something they don't like. Yeah.
Yeah. And this is also where the differential ability comes in, where sometimes they can perform things randomly really, really well. And other times they cannot with the, executive functioning abilities.
It's inconsistent and definitely stronger for preferred activities and weaker for things they don't want to do.
Yeah.
What else? Impulsivity.
Oh, big area within executive functioning. Yes. Yeah. Highly
These kids are impulsive, meaning they are not thinking about what they're doing.
Well, they literally don't have the brain capacity to do that yet. And inhibition or stopping impulsive thoughts or impulsive behaviors is the prefrontal cortex. And they're still growing there. Literally, their brain is still functionally getting bigger. So they don't have that in their hardware yet.
Yeah, their ability to sort of think through things or,
think about the consequences of this action.
Consequences, stop, pause, that reflect. That's not working memory. So your, ability to sort of like remember to do multi-step things, like being able to hear your parents say, like, put on your PJs, go brush your teeth and get in bed. Yeah. Like that kind of thing is challenging for a 3 to 5 year old. Yeah. And yes, selective hearing.
Selective hearing, yes.
Yeah, they'll just listen. They hear what they'll respond to what they want to respond to.
Yeah, and that's developmentally appropriate and expected, and then they're not trying to be a jerk on purpose.
Yeah. I mean, still that idea, like a lot of times with my daughter, when I'm trying to get her attention, she's very absorbed in what she's doing.
Sure.
And so that's all of this is really typical.
That's the shifting attention that's part of, of eventual executive functioning.
Yep.
But when you're developing it, you don't have the ability to shift attention easily.
Right. So it's really common to not hear or get really absorbed or get distracted when you've asked them to do 2 or 3 things.
Right.
Or, not like act.
Right.
Act before they think or be able to process. That's all super common ages 3 to 5.
And it's frustrating for us as parents for sure, and exhausting.
Yeah. Oh, definitely. When I feel like I have to tell my daughter things multiple times, it does get really frustrating.
Yeah, it's so hard not to respond negatively in that place.
Yeah, and I find it the most helpful to go up to her and get her attention. I have to tell her, hey, look at mommy. Sometimes I'll ask her just to test her to see if she heard me. Like, did you hear what mommy said? A lot of times she knows what I've said.
Right.
too. She's engrossed.
I have a cue word that I use with my daughter. For some reason, she really loves numbers. She still is kind of a numbers girly. And I from a young age, when I was trying to get her attention, I'd say 48 or random numbers, and she would try to say the number back to me.
That's funny.
And then it kind of cues her into, hey, fool, I need you to pay attention to me. I need you to focus on something.
Yeah. And the yes, the common denominator being for these kids, it is unrealistic to expect them to pay attention or to necessarily hear you when they're engrossed in something.
Or to retain something that you've said.
Exactly. Or like if you're in another room, that's when all bets are kind of off.
Or if the TV is on, forget about it.
It's all of that super common. So it's helpful to have a strategy, right, for getting their attention, being near them, that kind of thing to help.
When should parents or caretakers look to seek support if they think this is above and beyond what I'm experiencing in terms of
that's a good. I think that's a particularly good question with this age group, because I do get referrals for ADHD for kids 4 to 5.
Yes.
And 4 or 5 is probably the youngest. I'll even take a look at ADHD for kiddos, but I'm pretty clear with parents that it's pretty challenging to determine if that's going on in this age range. They're still so young, and these executive functioning skills are still developing. Sure. But it is a good idea to have a baseline at that age if you're concerned. So it would be worth it to, maybe get an assessment. But it's anything in this category that feels like above and beyond their peers, like super above and beyond. Like, if they're in school or daycare and they're having a hard time being focused in circle time, like all the time, every day the teacher's talking to you about it. Tons of redirection, that kind of, that
or
kind
can't
of
follow a
thing.
one-step direction.
Can't follow one-step directions. Is impulsive to the point where they may be putting themselves in like dangerous situations.
Yes.
Like darting into the road kind of thing, despite repeated teaching, despite, like like trying to sort of teach this lesson, if it's still like they literally can't control their bodies, and these kinds of instances where they're getting into unsafe situations, that could be that could definitely be.
What's the next domain that we're going to be looking at then?
Social functioning.
Oof.
This is another one I think that is like kind of big, and there's such uneven skill development that I think I thought I learned a lot and thought it would be helpful to talk about. So what do you think about social development for this age?
This is a transition period in terms of social development in my mind, where they're transitioning from kind of parallel play, where they'll play with, and I'm using air quotes for those listening, with someone, but they're not interacting in that play. So that's kind of like playing like in parallel
like
to someone else,
next to them, like doing the same thing that they're doing, but not really together.
Right. Well, this is when the beginnings start towards the end of this developmental period of interactive or cooperative play, and it's still rough and bumpy and uneven.
Learning to play together,
taking turns is hard in this period of time.
Taking turns and sharing. This is very hard for my child.
Yes.
She
will
literally say that she doesn't want anyone else to be around because it's so much harder to share space and take turns. So it's really not super realistic or appropriate to expect a 3 to 5 year old to want to take turns and share.
I think, and that's important nuance that I want to make sure and highlight for people. They're not going to want to do that. It's okay, and it's generally speaking appropriate to sort of help and be open to teaching. But harping on that or making that a huge focus or worrying about it if they're not great at it is maybe less helpful to you and your kid.
Exactly.
Is that a good way to frame it for folks?
Yeah, these are all skills. Like all of these things in these domains, like they're developing and they're teachable. So it's not like we don't want to be encouraging turn taking and sharing.
Right.
But we want to keep in mind that it is not easy or realistic. So if there are big feelings also about having trouble, not wanting to take turns or share, that's okay.
That's appropriate.
This is a common one from my daughter, meltdowns around this kind of thing.
Right. He won't share. She won't share. Right.
And also I'm trying to, with my daughter, encourage like her to, keep a hold of her things for, as long as she wants to and share when she's ready. So that's an added layer, I feel like, that makes it a little bit more complex. So, I try to, when another kid wants something that she wants, like, are you ready to share? She'll say no. Okay, let's go a couple more minutes, and then we're going to be done with our turn.
Right.
But these are ways that we encourage skills. We're developing skills, and we kind of have to scaffold and teach, and then expect that they're going to have a hard time with it, and lots of big feelings around it.
I always remind people, anyone that's looking at learning a skill or helping someone else, like a child, learn a skill. It's called learning. It is not called knowing. And we go to school for a large number of years in the United States to learn things. So it's unrealistic in my mind that after a week or so of introducing a new skill or encouraging a skill socially, that a kid would know it.
No, and also like this is so true with my daughter. Like we are like kind of harping on. Sometimes we can like go to social like public places, and she is a rock star sharing and taking turns.
Sure. Like other times,
I'm telling you, we have to take multiple breaks because she is screaming in kids' faces and like not wanting to share or take turns, or like unrealistically expecting all the children to do what she wants.
Right. My daughter has a problem too.
She's kind of
she wants everyone to do exactly what she wants all the time.
Everyone to do exactly
what she
wants all the time.
And that's not socially acceptable.
No, but it's also very common in this age group. So it's like balancing this like this is normal.
Right.
And also we can't yell in other children's faces.
No, that's not safe.
So we have to take like a lot of breaks.
Right.
And I'll just take her to a quiet place or a place on the side, and she will usually just sit or get in my lap and
find a way to co-regulate.
Yeah, we'll take a few minutes, and then she'll calm down, and then she'll be ready to try again. And sometimes she can do great, and other times we have to take another break. We just keep taking breaks. And then we just keep trying because I'm, trying to develop the skill. We're learning and there's big feelings. And, so sometimes when we're out, that's kind of like what we're doing.
What is in this domain? So we've covered 3 domains. In the social domain, when should a parent or caretaker seek support in this domain? Because this is really tricky.
If you notice your child is more of the time not interested in engaging with other kids.
So lack of interest.
Lack of interest in interacting might be something that you would want to seek some support around or kind of be curious around. I think about the sort of social give and take.
The reciprocal interaction.
The reciprocal. So if there's sort of like inconsistent or limited, being able to do the give and take of social interaction. So like eye contact, or sort of responding to names or questions, or when you seek connection or bids for connection, they don't seem interested or like they're motivated or able to reciprocate. Okay. And that could be verbal too, but
and this is important for kids that are shy or more reserved. That's not what we're talking about with this. There's a real distinction where, again, a lot of these things, when we're talking about seeking support, it needs to be across settings, which means at church, at home, at daycare or school, all of these areas, there's your kiddo is struggling in this area, and that's more of the motivation. If you just have a little shy girl or guy, and they just need longer to warm up, or they only feel comfortable with like maybe a cousin or someone they're really familiar with, that's just called being introverted. That is not a cause for concern. That is different than this.
Yeah, exactly. Yeah, I mean, exactly. So, what else? So we've got, so I think the independence and autonomy. This is a big category.
Big.
Okay. So these kids, ages 3 to 5, they are in this developmental period called initiative versus guild.
Okay.
So Erik Erikson,
very famous psychologist.
Popular, child development, child development psychologist and researcher.
Would be considered one of the fathers of child development.
One of the fathers of child development. He sort of created or kind of came up with these stages of development.
Right.
The idea that, at each stage there's a task to be accomplished, or there's like a child has a primary job.
Right.
So for this age, the primary job, like what they are supposed to be learning, is that they can act on the world.
Okay.
That they can make a difference, that they can explore, they can take action, they can create, that
their impact matters. Their
that
impact
they have
matters.
Agency, that they can like do upon the world.
Which is why there's so much autonomy seeking and so much trying to open doors and open cheese packets, even if sometimes you can't eat a dead random fish on the side of a river or a lake.
Exactly. So
basically,
you get a lot of, I want to do it.
No, I'll do it myself, or I don't need help.
I'll do it myself.
Let me do it, or
Yes, all the time. So then, with this stage, it's super, super common to have a lot of power struggles.
Right, because sometimes they're going to want to do stuff that they, A, functionally can't do, or B,
do it.
Is an unsafe thing to do.
Or also with me, one of my growth areas is like I have this time urgency. So if there's not enough time, that one gets in the way for me and my daughter.
That's a lot of parents feel like we got to go. We don't have a ton of time to let you kind of wrestle with your socks this morning.
Yes.
Right.
So I will often talk to my daughter about like, we don't have time to practice today, honey.
Right.
I know you really want to. We'll do that on the weekend when we have more time, or I'll give you 1 more minute, sweetheart, to do that yourself. And if you can't, I'm going to have to help you.
Yeah.
And of course, this is on mornings where I'm super regulated and it's going super well, because other mornings I'm like, get in the car.
She's joking.
I have to
She's telling a jokey joke, guys.
I have to go to work right now.
We're late.
We're late.
Yes.
I try really hard not to put that on her,
it's
but
hard.
It is hard when she wants to do everything
herself.
So the agency, but it's like their job, because if they're able to successfully get through this developmental period, the idea is that your kid will feel confident to initiate.
Right.
Will feel like they can act and explore and be creative. And, that's...
It's hard. It can be scary for parents, but the goal is to foster this independence.
To foster
it without shame. Without fear, like making them fear, like, oh, you don't want to make them afraid to be adventurous or to try things.
Sure,
that can be problematic.
Yeah, but exactly with limits. Right. So I'm like not going.
Well, no, things wouldn't be functionally unsafe. But if you just have a personal anxiety, like I have a personal anxiety that's slightly irrational. Like I have the door anxiety of my kids' fingers being indoors.
Oh yeah. Yes.
So we've talked about this.
Yeah.
So like when her daughter comes over to my house, I'm very anxious about doors. But her kid's an awesome door closer.
She loves doors and she's really good with doors.
So it's my issue where she's okay to have this autonomous independence. It's a me issue, not a Penelope issue.
Yeah, I do think our fear and anxiety absolutely gets in the way of allowing our kids to be independent and autonomous sometimes.
Exactly.
Definitely because of our fear. And I'm not scared of the finger thing, but I have definitely other fears.
In other areas.
Right. That make it challenging for me to let her have autonomy
Yep.
and do it. And I'm often sort of teetering between like,
right.
Is this safe? Can she do it, or do I need to help? And so we get into power struggles,
right.
and there's resistance because I'm trying to allow her independence, but also there are limits, and then, yes, anxiety, concerns, it all.
I think a lot of parenting is teetering.
A lot of parenting is teetering right on the edge of something really
How can I help keep this kid safe, but let them experience what they need to experience in the world?
Yeah.
So tricky.
And it's like literally the job of these children.
Right.
So it becomes like kind of important for us.
Yes.
To manage some of our anxieties and, for me to like take a deep breath in the morning when I'm feeling really.
Well, for me to have confidence in Penelope.
Exactly. Right. So, like if our own anxiety does get in the way too much, or if, all of this is discouraged enough or punished, right, then it is more likely that a kid is going to feel guilt about their needs.
Right.
They may feel, you may get a child who's a bit more overly compliant.
Which sounds good on the front, right? Ooh, a compliant kid. I would love that. That would be wonderful. Please give me one.
Well, and that's why I said overly, right?
Well, and that's where
compliance is nice.
That's where it's really more about, even though it's really frustrating and hard in this age range, it's so important to have this ability to allow them to explore the world around them.
Exactly. Yeah, so that they can develop this confidence and, they can speak up for themselves and experience the
This
world.
is a tricky one, I think, when looking at seeking support, though. I want to make sure we have time for that. What would, if a kid that you're with or that you're parenting, when would you seek support in this area?
Well, so I have some experience here because I, have recently kind of sought out some more support for my daughter, because sometimes I think when things are more chaotic or she's more anxious or she's having more trouble, some of this stuff gets super rigid, like really, really, really rigid, like, bossiness and wanting control, all that's really normal. But sometimes she can really get like it starts to impact functioning, right? It starts to get in the way.
Right.
So we've sought out like some play therapy for her to help, like a little extra support in that way. So if it starts to feel rigid or like problematic, again, pervasive, persistent across settings, impairing functioning.
Right. If you're having a meltdown that's over like 45 minutes because they wanted to tie their shoes and they cannot down-regulate, that might be a time.
Yeah, especially with support.
Right.
Right.
Okay.
So, I think this stuff is just important to keep in mind because we want to have appropriate expectations for our 3 to 5 year olds.
What's the last domain that we have to look at today?
So sensory sort of challenges and transitions.
So let's define sensory real quick for some folks, because people might not understand this that are watching or listening. Sensory is basically, we have the 5 senses, and kids that might have, so senses are another thing that develops, aka is like growing and developing. We don't come with a fully intact set of sensory understandings, like our brain or our body.
Yeah, it doesn't process sensory information perfectly well right out the gate.
So sometimes kids in this area might be like more sensory seeking, meaning they're looking for more sensory experiences, which is my daughter from a young age.
Like moving a lot,
or like
spicy
dropping
stuff, or
to
loud
the floor,
stuff, or
rubbing the carpet, like trying to touch everything, even though that's not always appropriate.
Yeah,
that is actually within
reason, totally appropriate at this age, as well as the avoiding piece.
Like not like for a while, I would have to cover my kids' ears and almost sit in a closet because the lawnmowers were here. Like that level, right, of challenge can be somewhat typical in development. However, if it's persistent,
like noise sensitivity, clothing, having clothing preferences, like food texture issues,
tags.
Like, all this is developmentally like pretty normative. But again, like if it's pervasive, persistent, like, you're having severe meltdowns, tantrums, like power struggles over clothing, or it's limiting functioning because of noise or light or whatever, that would be a problem. But
absolutely,
in general, that stuff is typical. Difficulty with transition, so more meltdowns around changes in routine or bedtimes, morning times, like times where there's more transition, more
when they
stress,
have to change from one area or activity to the other.
To another. Yeah. Or yes, more stressful life situations. All that would be considered transition, and kids this age have a hard time with that. The whole post-school meltdown, that's pretty common.
Overwhelm of coming from
being able to kind of hold it together at school for most of the day and then
just
losing it when they get home.
Right.
Super common for my daughter, for
yeah,
sure.
For a lot of people's kiddos, I think.
Overstimulation. So that's all really, really common within reason, as long as it's not pervasive, persistent, and like impairing and across settings is really what we're wanting to like drive home. So keep these in mind for just when you're worried about your kid, or when you ask yourself, like, is the expectation from my child developmentally appropriate based on what we've told you? And then I think that can just help with a framework.
I think it helps us tolerate knowing that it's typical or relatively appropriate for them to have these struggles and for you to kind of unfortunately struggle with them. Anytime we can understand our experience as people and parents, it makes it easier to tolerate and get through. Mm-hmm. So that's kind of, I think, the overarching thing that I'm taking away from today is it's typical for my kid to feel like they're a jerk that can't share, and it's mean, right? In this period, it's typical. And
it's pretty typical, and it's something that we really have to help develop. So that's, kind of what
Is that what you're taking
away from here? A couple of things. One, it's totally, regressions are normal for a kid to revert back to unhelpful or more immature behavior in some ways in this age group. And then also, it's really about teaching skills. Like, our kids, they're not giving us a hard time. They're having a hard time with the skills that they are developing.
Right. It's not personal.
It's not personal. We're these kiddos have only been in the world for
a limited number of years.
Just a little bit of years. Sometimes when I think about that with my daughter, I'm like, it makes so much more sense. I'm like, gosh, she's so tiny. She's been here for 4 years. I have these troubles, and I'm a nearly 40-year-old woman. I have meltdowns.
That is a whole different episode. That's a whole different episode.
I'm like, she's 4. I think she's okay, and I think we're doing our best.
We're doing our best, and you're doing your best.
We're all doing our best, and we thought just having this information would be helpful. And you feeling a little bit more confident that you're doing your best.
Right. Leave us a comment. Let us know your parenting journey if you are one, or maybe like your journey as an aunt or uncle or around kids. We'd love to hear from you. This podcast is intended for informational and educational purposes only and is not a substitute for therapy, diagnosis, or any kind of professional mental health treatment. We hope that we can share with you our experience authentically and genuinely, and we hope that occasionally we'll make you laugh. Maybe you can relate to our quest and how we're psyched for sanity. The content we share is our personal opinions and insights. They are not clinical insights to anyone, and they don't represent or reflect any entity that we work and or have worked for in the past. But if listening to this podcast has made you think, we really encourage you to seek out a mental health professional in your area.